Understanding endometriosis. Endometriosis is a common gynecological condition. It occurs when tissue similar to the lining of the uterus, called endometrium, grows outside the uterus. This misplaced tissue can attach to the ovaries, fallopian tubes, bladder, intestines, and other organs in the pelvic area. Sometimes it can even spread beyond the pelvic region. The tissue acts like normal uterine lining, thickening, breaking down, and bleeding during each menstrual cycle. However, unlike menstrual blood, the blood and tissue from endometrial growths have nowhere to go. This leads to inflammation, pain, and the formation of scar tissue. Endometriosis can cause a range of debilitating symptoms and impact various aspects of a woman's life, from her physical health to her emotional well-being. It's important to understand that endometriosis is a chronic inflammatory condition. It can range in severity from mild to severe, affecting each individual differently. The exact causes of endometriosis remain unknown, but several factors are thought to contribute to its development. Endometriosis is a complex condition that requires comprehensive management strategies tailored to each individual's needs. While there is no cure for endometriosis, there are effective treatments available to alleviate symptoms and improve quality of life. Endometriosis affects a significant portion of the female population worldwide. It is estimated that around 10% of reproductive age women and girls globally have endometriosis. This equates to approximately 190 million individuals experiencing the often debilitating symptoms of this condition. The prevalence of endometriosis highlights the need for increased awareness and understanding. It emphasizes the importance of early diagnosis and access to effective treatment options for those affected. Despite its prevalence, endometriosis often goes undiagnosed for years. This is partly due to a lack of awareness among healthcare providers and the general public. The impact of endometriosis extends beyond the individual. It poses a significant burden on healthcare systems globally, with substantial costs associated with diagnosis, treatment, and lost productivity. The widespread nature of endometriosis underscores the urgency for more research into its causes, prevention, and improved treatment options. Addressing this global health challenge requires a multifaceted approach. This includes raising awareness, reducing diagnostic delays, and ensuring access to quality, affordable care for all women and girls affected by endometriosis. Endometriosis can manifest with a wide range of symptoms, making it challenging to diagnose. The most common symptom is pelvic pain, which can vary in intensity and type. Some women experience excruciating pain during their periods, while others have chronic pelvic pain that persists throughout the month. Pain during or after sexual intercourse is another frequent complaint. Additionally, endometriosis can cause painful bowel movements or urination, especially during menstruation. Heavy menstrual bleeding is also common, sometimes leading to anemia. Beyond physical pain, endometriosis can take a toll on mental health. Many women experience fatigue, bloating, nausea, and digestive issues. The chronic pain and infertility associated with endometriosis can contribute to anxiety, depression, and emotional distress. It's important to note that symptom severity does not always correlate with the extent of endometriosis. Some women with minimal endometrial growth experience severe pain, while others with widespread disease have few or no symptoms. This variability makes diagnosis even more challenging and highlights the importance of individualized care. Section 4. Causes, a complex puzzle. While the exact causes of endometriosis remain unknown, several factors are believed to play a role in its development. Retrograde menstruation, where menstrual blood flows back into the pelvic cavity instead of out of the body, is one of the most widely accepted theories. This retrograde flow can carry endometrial cells, which may implant and grow outside the uterus. Genetics may also contribute, as endometriosis tends to run in families. Hormonal factors, particularly estrogen, are implicated in the growth and development of endometrial tissue. Immune system dysfunction is another potential contributor, as research suggests that women with endometriosis may have alterations in their immune response, allowing endometrial tissue to grow outside the uterus. Environmental factors, such as exposure to certain chemicals and toxins, are also under investigation. However, more research is needed to determine the specific environmental triggers and their role in endometriosis development. The complexity of endometriosis suggests that it's likely caused by a combination of factors rather than a single cause. Further research is crucial to fully understand the underlying mechanisms that drive endometriosis, leading to more effective prevention and treatment strategies. Section 5. Impact beyond physical pain. The impact of endometriosis extends far beyond physical pain. This condition can significantly affect a woman's quality of life, impacting her relationships, career, and emotional well-being. The chronic pain and fatigue can make it difficult to maintain daily activities, impacting work productivity, social engagements, and personal relationships. Many women with endometriosis struggle with infertility, adding emotional distress and financial burdens associated with fertility treatments. The unpredictable nature of endometriosis symptoms can lead to anxiety and fear, making it challenging to plan for the future. The social stigma surrounding menstrual health issues can make it difficult for women to discuss their symptoms and seek help. This can lead to feelings of isolation and shame, further impacting their mental health. The financial burden of managing endometriosis can also be significant, with costs associated with doctor's appointments, medications, surgeries, and lost wages. Addressing the multifaceted impact of endometriosis requires a holistic approach that considers not only the physical symptoms, but also the emotional, social, and financial challenges faced by those living with this condition. Section 6. Diagnosis and treatment. A challenging journey. Diagnosing endometriosis can be a long and frustrating process. There is no single test to diagnose endometriosis, and symptoms often overlap with other conditions. The diagnostic process typically begins with a detailed medical history and pelvic exam. Imaging tests, such as ultrasound or MRI, may be used to visualize the pelvic organs and look for signs of endometriosis. However, imaging tests alone cannot confirm the diagnosis. Laparoscopy, a minimally invasive surgical procedure that allows direct visualization of the pelvic organs, is considered the gold standard for diagnosing endometriosis. Treatment for endometriosis aims to manage symptoms and improve quality of life. Pain management is a cornerstone of treatment, often involving over-the-counter pain relievers, or prescription medications. Hormone therapy, such as birth control pills, hormonal IUDs, or GnRH agonists, can help regulate hormones and reduce endometrial tissue growth. In some cases, surgery may be recommended to remove endometrial lesions and scar tissue. Surgery can be performed laparoscopically or, in more severe cases, through open surgery. The choice of treatment depends on the severity of symptoms, the individual circumstances, and their desire for future fertility. Section 7. Global efforts and the path forward. Recognizing the significant global burden of endometriosis, the World Health Organization, WHO, is actively involved in raising awareness and promoting research into this debilitating condition. The WHO emphasizes the importance of early diagnosis, access to quality care, and the development of effective, safe, and affordable treatment options. Efforts are underway to standardize diagnostic criteria and treatment guidelines to ensure consistency in care across different healthcare settings. The WHO is also working to reduce the stigma surrounding endometriosis and encourage open conversations about menstrual health. Collaboration among researchers, healthcare providers, policymakers, and patient advocacy groups is crucial to advance our understanding and management of endometriosis. Continued research is essential to unravel the complex causes of endometriosis and develop targeted therapies that address the underlying mechanisms of the disease. By working together, we can improve the lives of millions of women and girls worldwide who are affected by endometriosis. Through increased awareness, improved diagnostic tools, and innovative treatment approaches, we can strive to alleviate the burden of this condition and empower women to take control of their reproductive health.